In this video, you're going to learn what ringworm is, how you can catch it, what it looks like, including a whole bunch of real-life clinical photos, and how you can treat it. And in addition, when you might need to go and see your doctor if you think you or your loved ones have ringworm. Hi, I'm Dr. Brian. So first of all, what is ringworm? In medicine, you have your roundworms, your flatworms, your tapeworms, and your ringworm. But ringworm isn't actually caused by worms. Instead, it's actually a fungal infection, and it's a very common group of fungus known as dermatophytes. Dermato means skin, and phyte means plant. So it's a skin plant, and it's actually closer to a mushroom or a mold on your bread than a worm. And this fungus feeds on a protein known as keratin, which is found in your dead hair, skin, and your nails. So the medical name for these fungi is tinea, and there are multiple subtypes. There's tinea corporis, which is the form that appears as rings on the skin, which are slightly raised and have an expanding border. And then there's tinea capitis. This is ringworm on the scalp. It's really common in children, and it can be really important because untreated, it can cause permanent hair loss and bald patches. Then there's tinea cruris. This is jock itch. It occurs in the groin area. It tends to have a red outer border, and it can be extremely itchy and uncomfortable. There's tinea pedis, which is also known as athlete's foot, and this affects in between the toes, in particular itchy red scaly crack and blistery changes. There's tinea manum, which is the hands, or tinea unguum, which is in the nails. This can affect the hands, cause the nails to become thickened, discolored, crack, and break. Well, how do you get ringworm? Well, you can catch ringworm from a number of things, places, people, and animals, or infected objects. So things like bed sheets, combs, towels, or if you're in the shower and you don't wear shower shoes. It's super common in some sporting events like wrestlers that are in contact with other wrestlers, so there's skin to skin contact with individuals who have ringworm. Another very common way to catch ringworm is from the family pet, particularly the family dog. This often spreads from the dog to a child, and because you don't realize where it's coming from, the child keeps getting it over and over again. And until you treat the dog, the kids keep getting it. The main sign of ringworm is a roughly circular rash. It can look red, silver, or darker than the surrounding skin. This really depends on your skin tone. It typically begins as a flat, discolored patch, and it appears red in lighter complexions and brown in darker complexions. The patch has a ring-like or circular shape with a raised, scaly appearing border. I'll remind you, the rash can appear anywhere on the body, including on the scalp. And sometimes the rash grows and spreads, or there can be multiple sites of this ring-like rash. Now, if you think that you or your child have gotten ringworm, what do you need to do? Well, the good news is that it's usually easily recognized, and that most of the time it can be treated with medicine. You can just buy it over the counter. In the United States, tinactin, lotrimin, these both contain active ingredients that are very good to fight this fungus. It's known as tolnaftate and clotrimazole. And most of the time, you don't really need to see a doctor. You do need to use the medicine every day, sometimes up to 4 weeks, because the fungus can be really resistant, and if you don't treat it, it will come back and it can be spread. There are some cases when you might want to consider seeing your doctor, and these are really if the ringworm hasn't improved despite using the very common antifungal medicine, or if you have ringworm on your scalp or in your nails, because oftentimes that requires a prescription antifungal tablet, a medicine that you take by mouth, or medicated shampoo. Also, there are other rare times if you have a weakened immune system, such as from taking chemotherapy, you're on high-dose steroids, or you have diabetes, then it may be worth seeing your doctor as well to make sure you're doing the right thing. Now, how do you prevent ringworm? What can you do to not get it and to stop ringworm from spreading? Here are my top tips for this. First of all, start treatment as soon as possible. Keep your skin clean and dry. Don't walk barefoot in areas like locker rooms or public showers, and avoid direct contact with anyone that has ringworm. Don't share clothing, towels, sheets, or other personal items with someone who has ringworm. Again, this includes combs. And try not to scratch parts of your body that might have ringworm, because this can spread the ringworm just on your own skin to a new place. You also want to regularly check your skin if you've been in contact with either an infected person or an animal. And finally, take your pet to the vet if they've got ringworm. If you see patches of missing hair or fur, this can indicate they have ringworm, and that'll spread from them to you to your kids. That's ringworm. Thanks for watching, and I'll see you next time.